This is really about the single biggest change that we need to make in our NHS, because as we grow older, and it's a wonderful thing that we're living for longer, we all want to know that our mum or our grandfather is going to get constant care from the NHS if they have a long-term condition, early stage dementia, asthma, a heart condition, whatever it is. And we want to know that there's someone in the NHS where the buck stops who's really going to take responsibility for their care. And we have that with many wonderful doctors, but we need to do a lot better. And today's announcement is really saying that for nearly 1 million of our most vulnerable older people, we're going to move to a model of proactive care through their GP surgery, so that the GP won't just wait for them to get in touch when they have a problem. They'll be on the phone, "How are you doing, Mrs. Jones? How are you feeling?" And that way we can head off problems, hopefully prevent them ever having to go to accident and emergency departments, and keep them healthy and happy at home, which is where they'd like to be. There is extra work, and that's one of the reasons why the other part of today's announcement is that we're announcing plans to train up an extra 10,000 clinicians to work in the community, GPs, practice nurses, district nurses, other people who can work in the community, because we do recognise that GPs and nurses in the community work extremely hard. But I think it's a false economy if we don't invest in out-of-hospital care, because in the end, if you don't look after people well when they're at home, they end up having to go to hospital, and that ends up being worse for them and, of course, costing the NHS more as well.